Yeah. Okay, so now we're gonna do her Marionette lines, which is one of my favorite injections. So the skin starts to fold this way as we age. We're not gonna completely correct them, but we're gonna make it look so much better. We're gonna add the filler right in front of these little pockets so it looks lifted and it doesn't look as deep. Ready for number 2?
Yeah.
Again, I'm using Restylane Define, which is a thick product, and just place, it's like molecules, boluses of filler to create a lift for her. Du das ein bisschen mehr weh oder nein? There's different techniques. There's boluses, which I'm doing right now. And there's a fanning technique, which I will do now. And then I try to lift up the corners of her mouth. So much better already. It's gonna feel a little bit numb, okay? Because there's lidocaine in here, so the numbness will go away in about 30 minutes or so. Alles gut?
You really see it on the video wrong. Yeah.
Also, I like to put boluses and structure right below her lip so we can literally get that little lip corner up. Already looks so much better. But see, she still has a divot down here. So we're gonna add filler a little bit lower to basically recreate what she had 20 years ago. Or 15. Just lift it all back up. Can you get me down? Yeah. So much better. Also, this area, she might have little bumps afterwards, but that all will settle down within like 5-7 days. I tell all my patients, give it a good week, 10 days, and the filler has settled down. Almost done on this side. Can I have a fresh photo? Okay, so now watch the difference. That was one. Much better. And then I also will fill these little guys with some different kind of filler, so we'll lift those up. So much better. Look at this difference, so much better compared to what we obviously can do without, you know, any surgical procedure. Okay, ready? You're good? So same thing. Every side is different. Some patients need more on one side versus the other side, so a good injector can kind of take that into account, and sometimes I add more to one, more to the other side. And we can pick up the corners of her mouth. Thank you for being such an easy, amazing patient. This is, do it again. No, up, scrunch up. This is called the orange peel right here. We put a little bit of Botox in there, like 8 units, and it'll be super smooth in a few days. So very low in the platysma mentalis muscle, and when she comes back in 2 weeks, it'll be so smooth. Another little trick in our box. We're going to do just one more thing for her. Machen Sie mal so mit Ihren Lippen zusammen. These lip lines, when we call pucker lines, and then relax. We're gonna add a product called Velour into the actual lip lines, and it's gonna make it look so much better. So a combination of Botox and a not too thick of a filler, so something like Velour or Juvederm, Ultra, Restylane Refine. We can plump them up a tiny bit. Pucker, So yeah, I do Botox and I put a tiny bit of filler. It's gonna look so much better. Ein bisschen Eis da auf der Seite. Das tut nicht weh, ja?
Nein.
Okay. And then pucker. I like to transfer the product into a little insulin syringe because then it's really easy for the patient. And we can be very specific where to put the product. Easy?
Easy.
Yeah? Okay. So, how are you feeling?
Good.
Good?
Very good.
Okay, I'm pretty much done.